Thank you, Phil. You kind of gave a pretty good overview of activities at Land and Sky, and I don't think I'm going to spend a lot of time on that point. I will just kind of give a very brief background on what is the Land and Sky Regional Council. It's a multi-county. We serve 4 counties: Buncombe, Henderson, Madison, and Transylvania. And we're one of 17 organizations like that across the state. The council is made up of elected officials and county managers, and they basically provide guidance to the staff and approve policies and directions overall to the organization. We have about almost 50 staff across the entire organization and working on well over 50 different projects. I think the number is probably closer to 100. I didn't count all the details in our registers. The core values for Land and Sky include things such as regionalism and the well-being of the region, healthy people, healthy economy, and excellence in public services. But there's many more values that are included in that as well. We have 3 different departments. We have a local government services, a volunteer services, and then the Area Agency on Aging. Local government services provides a variety of planning, development, grant writing, and project management to our local governments. Areas of focus include growth management, transportation, housing. Another important focus area is a brownfields project, which is reclaiming old industrial sites and converting them into either office space or residential space. A lot of work has gone into that project area. And then we have a group called the Waste Reduction Partners, which is older retired engineers and scientists and whatnot who work on improving energy efficiencies in building mostly public buildings around our region, really around the whole western part of the state. But that has provided incredible savings to those that participate with it. The volunteer services section works to just connect people who are interested in volunteering to become either mentors or coaches or companions to people in need, and to contribute their skills to community organizations. Programs include, in the volunteer section, include the Retired Senior Volunteer Program, Senior Companions, and the Foster Grandparents. The Area Agency on Aging, and that's the part of the organization I'm the director of, we work to help identify needs and desires of older adults and work with counties to help plan the services to meet those needs. Working with community partners overall, our functions include the planning, coordinating, and monitoring services that are designed to help seniors remain independent, and delivery of services such as the Family Caregiver Program, the Ombudsman Program, health and wellness initiatives. There is more information available on those services at our vendors table. That's over under the big topic tent. We've been very involved in planning overall and have worked closely with all the names that Philip read off earlier, or noticed earlier, are all part of our planning committees. And there's many more people here that are involved in different levels of different committees at different times. But we've worked hard to establish some planning parameters for Buncombe County. We have a really good aging plan for the county, and you can pick up more information on that, or at least website links to it at our table over there. We've got a lot of good health and wellness initiatives. We've got some really good people involved in that. And I don't want to go into a lot of detail on all that, but that's touching on that. I would say that overall Land2Sky is really involved in this living community initiative. It's currently in the formation stage, but it'd be an opportunity to unify plans across the region under an integrated regional sustainable, I'll use that word, regional sustainable development. Efforts will use the sort of symbolic arteries of the region, the French Broad River that runs through all 4 of our counties, and the interstate transportation corridors, 26, the new 26, the I-40, and then all the major sort of highways that connect them. But now on to the real reason why I'm standing here, that's to introduce our guest speaker. Dr. Bill Thomas is an international authority on geriatric medicine and longevity, and a passionate advocate for his holistic approach to aging and the care of our older adults. He brings a bold and inspiring message. Older adults are a critical and undervalued resource, and that fact must be the centerpiece of all approaches to care. A graduate of Harvard Medical School, he went on to graduate medical training in the Highland Hospital, University of Rochester Family Medicine residency. And while he had planned on a career in emergency medicine, he took a part-time position as the medical director of a small rural nursing home. And I think that was probably a life-changing event for him. We'll let him talk about that. In the early 90s, he and his wife, Judith, developed the Eden Alternative as kind of a critique of the status quo in long-term care. They offered a creative way to change that culture and bringing growth and laughter into the lives of the residents. Philosophy also called for fundamental changes in the relationship between staff and management. His book on the initial implementation project, The Eden Alternative, Nature, Hope, and Nursing Homes, was published in 1994. In 1999, he published another novel called In the Arms of Elders. This is a novel that highlighted the dignity and value of older people. To sort of emphasize the significance of this book and other of his thinkings, he went on a 27-city, 30-day theatrical tour that stretched from Boston to San Diego. This tour introduced thousands of people to the message of the Eden Alternative. During this tour, though, Dr. Thomas saw that America's nursing homes buildings were actually aging faster than the people living inside of them. This led him to imagine a new approach to long-term care that has become known as the greenhouse concept. Supported by foundations, he oversaw the construction of the nation's first greenhouse, and the model care is now being replicated nationwide. And in casual conversations before this introduction, there was talk of just that greenhouses and the work that's going on there. In his private life, he's the father of 5 children, 3 boys and 2 girls. He enjoys making music with his wife and spending time at home with his family. Turns out his home is in Ithaca, New York, and I'm somewhat familiar with there. I go there on vacations from just as often as I get there. But I want to share just a short personal factor on how I actually relate to Dr. Thomas. Earlier I mentioned that he received his medical training in Rochester, New York at Highland Hospital. Well, I was born at that hospital. That's where most of my 5 brothers and sisters. My parents received various treatments and care there, and unfortunately my mother actually died in that hospital. As children, we used to sort of take it as a playground. We would go up and play there, mostly on our way to our Little League baseball games, which were across the street at a place called the Lily Pond. I don't know if you He's got all these connections, that's amazing. Anyways, as we will soon see, he's a dynamic and entertaining speaker, and let's put our hands together and provide a great welcome.